So firstly, if I could say that what we all want out of a mental health system is that it's accessible, it's affordable, it's effective, and it feels right to the user. So if we look then at some priorities, one of the top ones has got to be how we get and keep and value a workforce. And of course, by that I mean a very broad workforce across the clinical sector, psychiatry, psychology, general practice, right through to the psychosocial support, clinical psychology, and engage with the lived experience. So workforce in all its manifestations has got to be one. I think another one, which is very difficult for governments, is, and it was mentioned today, is if we want something to be affordable, what is the right funding model for that to occur that makes people want to work in the system, but also makes them want to work in the right place in the system? And I think geographical distribution of services and what funding incentives we might need to put in place to have that is pretty important. I think the third, which is a sort of fairly ubiquitous policy position for mental health at the moment, is the engagement of lived experience. And I mean that more than engagement of lived experience in the workforce. I mean engagement of lived experience in a sense of development and ownership of the service platform, and all the other parts that go with that. Now, for each of those, I think you need to think about age ranges. So, as you know, we've got a bit of a focus on youth because of recognition of high levels of distress in youth, but also an understanding that we need to get to people early in life and need to help parents and families and, of course, our older people. So for Manna, with its focus on rural and regional and remote, it could take any of those and think, how can we demonstrate that we're using some of those systems, using engagement of lived experience, using engagement of the workforce or communities in developing and furthering the sort of models of care that the Commonwealth or the states and territories might want to be introducing all over. You know, what are the points of difference or discrimination for people living in regional Australia that might be of relevance to that, and what differences would we need to put in place? And one of the things that I mentioned in my talk was a support for regional commissioning. Now, we've been talking about regional commissioning for a long time. What we haven't done is be able to bring state and territory funded services and Commonwealth funded services. We might say overarching, we want them to stand by these principles. But how different should they be in different regions or different communities while maintaining those principles? And again, I would have thought Manna could help with that. And the Manna should be able to help with the evaluation and the outcomes and how you might measure the outcomes of those services.